In this video, we're going to be talking about colored contact lenses, the importance of them, what they can do, how they can help your vision, why it's important to take care of them, and specifically the top 5 ways you can take care of your colored contact lenses. And you're going to want to stick around to the end of this video to listen to the number 1 thing that you need to pay attention to when you're wearing your colored contact lenses. So let's get started. If you watch closely to the transitions and the scenes at hand, my eyes are actually going to be different colors throughout each shot. They could be blue, they could be green, they could be violet, they could be white, they could be gray, they could be honey, all different types of colors. So pay close attention to my eyes as we go over these top 5 things and top 5 reasons you need to be taking care of your colored contact lenses. All right, number 5 on this list is what's called the dK over T value. It's just basically a measure of how fast oxygen moves through these contact lenses in order to keep your corneas oxygenated, because the only way you really get oxygen to the cornea is from the air in front of you. So when air gets to the cornea, it needs to pass through that contact lens. So the particular brand I'm wearing right now, it's called Brilliant Blue, made by Air Optics Colors. Kind of looks like this in this box, basically. And the rating that's currently assigned to the Air Optics Colors is 110. So what does that even mean, Doc? So 110 is a measure of how fast oxygen moves through the contact lens to the cornea. The higher the number, the faster and the more amount of oxygen that moves through. The lower the number, not as good material, and it's a lot older material that does not transmit oxygen effectively, correctly, or up to what you need to be doing in order to take care of your eyes. So it's extremely important you look at that dK over T number, or sometimes just called a dK number. Make sure you ask your eye care professional what number your contact lenses can be, and sometimes they're even sold on the boxes as well too. Number 4 on this list includes making sure that you actually get your contact lenses from a trusted, reliable eye care professional, practice, whatever it looks like, your eye doctor, optometrist, ophthalmologist, whatever it may be. Because we actually work with a lot of manufacturers and a lot of different companies that make these kinds of colored contact lenses in order to get patients seeing their best, feeling their best, and in this case, looking their best for whatever type of color of eyes that you want to go with at this point. Because some material that's out there for certain color contact lenses can be quite outdated and a little old, to be honest. But you want to make sure you talk with your eye care professional about what the best situation is for your eyes and how you can help take care of them, but also see great at the same time. Number 3 on the list is making sure that you understand if it's like a monthly contact lens or a daily contact lens. Is it a contact lens that you need to put in case and solution overnight to make sure it gets properly cleaned and disinfected? Or is it a kind that you can throw away at the end of each day? Because it's extremely important that you know the differences between these two and what you're paying for and how you're wearing them. And honestly, it can work like underwear and socks a lot of times to make sure whether you have daily disposable underwear and socks or if you have monthly replaceable underwear and socks, you need to put in the washing machine and dryer every night after you wear them to keep them clean, to keep them lasting longer, and to make sure you see your best with them. Number 2 is making sure that the contact lenses actually feel comfortable. Can you see your best out of them? You actually feel like that on your eyes, that they can be normal to wear for an extended period of time, however long you choose to wear them. A few hours, several hours, whatever it may look like. It's important that they actually feel great and that you see great out of them. And with this in mind, that there are many more color contact lens options available for the non-astigmatism patients. So patients that have either just farsightedness or nearsightedness, there are a lot more options to pick from than those of us with astigmatism right now. I have astigmatism, and honestly, these don't fit that great on me because they're not shaped to my eyes correctly, and I'm not able to see the best with them. But that's besides the point. The point is that you need to make sure that these fit your eyes okay, or whatever brand of color contact lenses that you and your eye care professional decide upon, to make sure that it's going to work out the best for you and your vision and your eyes and your overall health. And the number 1 thing you'll want to know when wearing your colored contact lenses is to never, and I mean never, ever, ever, don't do it, don't even think about it, don't let it cross your mind, don't skip past this, don't sleep in your contact lenses. Because these color contact lenses, no matter which one you pick and which one you go with, are not rated for overnight wear and being able to keep your eyes healthy. Because think about it, when your eyes are closed, you're sleeping 5, 6, 7, 8, 9 hours, whatever it may be, your eyes are not getting that much oxygen. The way that they get oxygen is from the underside of the eyelids. There are a bunch of blood vessels contained in what's called the conjunctiva. It's a connective tissue that helps supply different areas of the eyeball, that the blood and oxygen move around the eyeball and passively lets oxygen diffuse into the cornea of the front of the eyeball. It doesn't do it as well as just your eyes being open in a normal day-to-day scenario. But when they're closed at night and there's contact lenses that are blocking the passage of oxygen being able to get to your corneas, you're suffocating your eyes and you're giving yourself a chance to have increased amount of risk for infection, blindness, vision loss, anything like that. It's very terrible and very devastating for the patients that we've seen that have actually lost their eyesight or have experienced some level of permanent vision change or loss because there's been some history of sleeping in contact lenses. So if you need to send this to a friend, if you need to send this to a family member, colleague, whatever it may be, to encourage them to not sleep in their color contact lenses, let this be known that it can permanently change your vision and permanently change the rest of your life when you take the time and risk in order to sleep in your contact lenses. I want you watching this video to think of it like this. When it comes to your underwear and socks, I'm going to go back to that again. Do you sleep in your underwear and socks on a regular basis, especially without cleaning them for 30 days? It's kind of gross to think about. But that's something a lot of times to paint the picture to relay the importance of the discussions that we get to have with patients in order to help take care of their eyes and make sure they can continue wearing contact lenses and be able to function without losing their eyesight when it can be easily prevented by just not sleeping in the contact lenses, but putting them in cases in solution, whether they're monthlies, 2 weeks, or if they're dailies, but just to throw them away at the end of the day. It's pretty easy and a very easily solvable, fixable issue. If you like this video and watching my eyes change colors, give it a thumbs up, subscribe to the channel, and tap the bell for notifications and to learn more about your eyes. I'm Dr. Bryce Heffington. We'll see you next time.